Stress urinary incontinence means that a woman experiences urinary leakage upon exertion, training, coughing, sneezing, anything that creates a sudden pressure or impact towards the pelvic floor and the urinary bladder. Risk factors for stress urinary incontinence are childbirth, vaginal childbirth, hysterectomy, obesity or being overweight, and hereditary factors. What happens is that the urethra will lose support, and when that happens, the closing muscle cannot close properly and urine will leak. Here we have the vagina, the uterus, the bladder, and the urethra. The muscle responsible for keeping a woman dry is a circular muscle around the urethra. This is the muscle that contracts when you cough, sneeze, jump, run, or make any sudden movements. This muscle depends on support from the anterior vaginal wall. Here you have the connective tissues, ligaments, and fascias that will support the urethra. If the urethra doesn't get the support it needs, it will bend. And when it bends, the muscle cannot close properly. This is something that occurs commonly after childbirth, where the baby on its way out will tear or press trauma to the supporting connective tissues. Another thing that may happen is that the pelvic floor muscles surrounding the vagina and also connects to the closing muscle, that they will get stretched and lose some of their contractility. When this has happened, this is something you can see during a gynecological exam upon provocation of the patient. If this happens, the solution may be one of several different alternatives. You may want to start with pelvic floor exercises, pelvic floor training, where you try to reactivate the pelvic floor muscles and make them give a better support to the urethra and the closing muscle. If this doesn't work, or if you already have a very good pelvic floor and that's not the issue, you may need to move on and have a surgical procedure. And what we do during the surgical procedure is that we place a tape as such, which will create a new support for the urethra. Now this tape will lift up the urethra and helps the urethra closing muscle to contract better. It also helps by absorbing the powers coming from the abdomen when you cough, sneeze, jump, and so on. And that's the most common way to treat stress urinary incontinence today.